Hey guys, welcome back to the channel. This is Sai Dental Vlogs and thank you all for showing so much support. And I am Dr. Abhishek, reader in Department of Oral Medicine. In Bhubaneswar, I make videos to dentistry and dental related topics. So today's topic will be about which branch you should choose for getting into MDS. Will you look into the job aspect or clinical aspect or non-clinical subject? So we'll discuss together about all these things. So basically we do MDS for mainly two reasons. First reason is like you will be an MDS and after that there is no particular super specialty dentistry in India. And the second reason is like if you want to grow your clinical practice, so whatever patients they do come to the clinic, they see the degree whether you are a BDS or MDS or not. In the long run I have understood that doesn't matter actually. But still it is required in few urban areas where people are more aware. A person who is staying in Mumbai, Bangalore is much more aware than a person who is staying in a village. Suppose I want to get my root canal, so I will go to endodontist, right? I have that idea. So similarly, that's why MDS is important. It is important, but if you are not having money, no problem. You can stay as a BDS and also you can do it later after saving some money, right? And nowadays loan also is easily available. So your MDS, first we'll talk about the fees of MDS. The average MDS fees for a clinical branch is around 10 to 12 lakhs per annum and the total cost will come around 36 lakhs. But in some colleges they give stipend. So stipend comes around 35 to 40,000. So the total income will come around 12 lakhs in 3 years. The stipend which you are as a student you will get 12 lakh 80,000. So you deduct it from 36,000, the total expense will be around 23 to 25 lakh rupees for doing a clinical branch, and for a non-clinical branch the fees is little bit lesser, around 7.5 to 7 lakhs. So the total expense will be around 21 lakhs. So regarding job aspect, suppose you are thinking ki I will do a non-clinical branch and I will get a job. So that is a wrong concept actually. Basically MDS you should take according to your will, means जो आपका अंदर से दिल से मन करता है. Suppose you are good at endo and you want to learn more into endo, more microendodontics, all those things, then you take endo. If you are like while doing the surgeries, you feel lot of motivation and you feel enthusiastic, then you should go for surgery. Whatever your heart tells, that branch you should take, because in that branch you are going to shine like anything. And suppose you researched and you asked everyone which branch is good for me, then you may end up choosing a branch which you may not like after joining, but you have to do it jabardasti or not willingly because you didn't wanted it actually. So before joining MDS, be sure of what branch you're going to take right from the final year itself, because choosing a career is very important. Choosing a branch, this is gonna stick to you your entire life, and in India you cannot do 2 MDS. Right, so that MDS is gonna be with you for your entire life and it's not gonna change. So that is the important thing. Now we'll talk about different branches. Suppose you do in endodontist, you become an endodontist, and that is the main bread and butter of the dental clinic. 90% of the cases they all come dental caries and all. So you have to do RCT in your clinic and it will give you good result immediately. जैसे कि आप RCT करते हैं तो इमीडिएटली आपको पेशेंट का विद इन 10 days RCT खत्म हो जाता है, कैप भी लग जाता है, तो इमीडिएट उसमें पैसा मिलता है. एंड यू कैन गेट कंसल्टेशन फ्रॉम अदर क्लिनिक्स ऑल्सो. एंडोडोंटिस्ट्स आर द मोस्ट कॉल्ड अपॉन consultants, right? Second is what branch I like is prosthodontics. Prosthodontics is a huge scope because it has got a lot of things. RPD, FPD and implants, the upcoming branch. I think within a few years, implant is going to be a separate subject for MDS. What I feel. So in foreign countries it is there. So prosthodontics is also a very promising career, and prosthodontic people have good scope in college as well as endo. Because prosto and endo is right from first year itself, right? We go to preclinical labs and all. So first year से लेके final year तक prosto और endodontist teachers की demand रहती है. Okay. So the requirement for job is more for endodontist and prosthodontist than compared to any other subject. Like in surgery and oral medicine, these all subjects are in final year, right? So only final year students will read those subjects. So the demand of teachers is a little bit less in these subjects. But surgery is a very challenging branch. Deal with all fractures, TMJ disorders, then trauma cases, cancers, cleft lip, cleft palate, smile design. So these things are there, but in surgery it will take a long time to settle in your life. During your PG you will not learn all those things. You will learn a little bit of these things, and you have to join under some big surgeon. Just by doing MDS you will not learn anything. You have to join under some big surgeon or experienced surgeon to learn the work, and then you can start with your own career, and you can do some diploma and fellowship courses also in abroad. Now the periodontics is also upcoming branch. Periodontics is good for girls, what I feel, because periodontal work needs lot of patience. Flap surgeries, bone grafting, it will take a lot of time, and the techniques are highly technique sensitive. In fact, all techniques in dentistry are technique sensitive, but perio, what I feel, is much more technique sensitive, because suturing is always there, different type of sutures, bone grafts, implants. Implant have also been introduced, and in implants basically we have to take care of the periodontal tissue only. If the periodontal tissue is successful, the implant is also successful. So perio is a very good branch, what I feel. It's an upcoming branch. People who had earlier done perio from different colleges, initially they thought that perio mein kuch nahi hai, lekin now they are very happy by taking this branch, because implant fall under this perio. Then next comes the pedo. Pedo is a separate specialty altogether. Suppose मेरे clinic में, I'm just giving an example, if a patient comes to my clinic, I cannot handle, suppose there are 4-5 patients in my clinic, right, and suddenly a pedo patient comes. So what other patient, the adult patients, I'm doing very fast, but pedo patient you cannot do like that. You have to be very calm, and you have to make him understand, him or her understand, and you have to show him everything. So that takes a lot of time. I always need कि कोई अच्छे periodontist मेरे clinic आए and they do the treatment properly and give separate time to the child. So periodontic is a very special branch, what I feel. And this is a very good branch where you will learn all the orthodontics, RCTs, वगैरह. It's a very good branch. Non-clinical branch, what I feel, in non-clinical, सबसे best, what I feel, is oral medicine department, and with lot of patients, lot of lesions, and it's a very great upcoming branch because of the CBCT which has been introduced, and many other new technologies are also coming up in the market. So अभी उतना scope नहीं है oral medicine का, लेकिन few years के बाद, maybe after 10 years, oral medicine will be cases which other people don't get, right? Like we are not getting prostho-endo cases, but we are always getting pictures of OSMF, different kind of lesions and pre-malignant lesions. So उनको diagnose करने के लिए सिर्फ oral medicine वाला ही कर पाएगा. Oral pathology has a equal importance because oral pathology has to be with surgeons. एक सर्जन के साथ ओरल पैथ का कॉम्बिनेशन बहुत अच्छा होता है. सर्जन्स जो है दे विल रिपोर्ट के लिए भेजते हैं एंड ओरल पैथोलॉजी रिपोर्ट वाले बनाते हैं. कम्युनिटी डेंटिस्ट्री राइट नाउ इट हैज गॉट लेस जॉब ऑप्शंस इन दिस थिंग, बट as a MDS in community dentist you can do social welfare and you can do epidemiologic studies. You can join various institutes. It's a medical research center in which you do all the epidemiological surveys and all those things. So the job aspects basically in MDS is less only. If you know some person in a particular college, like you know the dean or the higher authorities, then you can easily get a job. But for a normal person like me, it is very difficult. If I leave my current job, it is very difficult for me to get a job into a different college. So never think of job after finishing your MDS. Start a clinic. Start with the basic things. Learn properly in your PG. Whatever you have done during your PG, apply in your clinic. Slowly your name will grow, and slowly you will get more money from the patients. And with time, if any vacancy comes in the college, after that only join the college. Never like from the very beginning itself go and search for job and get frustrated. Don't do like that. So I hope you like my video. Until then, have a very great day. Stay good.